Your child has been evaluated for a laceration in the emergency department. Now let's take a moment to understand what a laceration is, how it can be cared for at home, and warning signs you should look out for that would indicate that you should return to the emergency department. A laceration is a cut through the skin. Based on its length and depth, it may have required repair with stitches, staples, steri strips, or skin glue. Now that your child's laceration has been repaired and you are preparing for discharge home, here are some tips to continue taking care of your child's cut at home. For stitches and staples, keep the cut dry for 24 to 48 hours. After this, you can get the wound wet, but do not soak the wound in water, so no baths or swimming. You can gently wash the area around the wound with soap and water, and make sure to apply a clean bandage to the wound 1 to 2 times per day, or more frequently if the bandage becomes soiled. For skin glue, keep the cut dry until the wound is healed. Don't apply any liquids, creams, or ointments to the wound while the adhesive is in place. Do not scratch or pick at the adhesive film, as this may cause it to fall off prematurely. The glue should peel off naturally in 5 to 7 days. For surgical tape or steri strips, keep the cut dry at all times. If it gets wet, blot the area dry with a clean towel. Surgical tape or steri strips usually fall off within 7 to 10 days. For some wounds that are particularly deep or dirty, antibiotics may be prescribed. If your child has been prescribed antibiotics, make sure to take these as directed by your healthcare provider. Unless told by your healthcare provider that your stitches are absorbable, they will eventually need to be removed. The time frame for when they need to be removed depends on the location of the body that they were placed. Your healthcare provider will have given you specific instructions on when you should have your child's stitches or staples removed. Make sure to follow up within this time frame. You may be asked to return to the emergency department for a wound check. Please ensure that you do so if instructed. Even if you follow all these important tips at home to keep your child's wound clean, some lacerations can get infected, so it's important to know what to look for at home. Signs of infection include worsening redness or pain around your child's wound, a pus or bad odor coming from the wound, red streaks going up the extremity that the wound is located on, or a fever of 100.4 degrees Fahrenheit or greater. If your child experiences any of the following, return to the emergency department immediately for evaluation.